Despite human rights, despite the fact that the financial system, as I have said before, is merely a made-up thing, a construct, we are still far, far away from the world we say we should be living in. Despite religion, despite thousands of grand speeches, far too many wars, despite millions marching in protest for centuries, despite government policies, despite safeguards and policy and codes of conduct, there is the undeniable gap. A gap between our vision of a better world and the reality of the world we all live in. One such gap currently is the difference between the NDIS vision and the reality we have all been living. In the hopes to bridge that gap, the NDIS review panel have asked us to provide suggestions on how best we can bridge that gap to realising the NDIS vision. Following, I offer some thoughts on a few things that may help, not only to the review panel, but to the whole disability sphere. For there is no gap greater than the one that exists between people. There is often a gap between ideas and their realisation. There is also often a gap between belief and reality. Sometimes we know about it, and sometimes we have absolutely no idea what it is. We think we are so right for so long, and only time reveals the truth of how wrong we were. We have made some monumental fuck-ups along the way. The vision to go to the moon had to be realised with the fact that we did not yet possess the capability to do so. A significant gap, I would say. A journey had to be made and a viable pathway found. That and a rocket that didn't blow up the astronauts. When it came to human flight, gravity was a great leveller and teacher of reality there. However, eventually, with will and technology, we beat gravity, bridged the gap in knowledge, and we have soared in the skies ever since. It takes determination and an act of true courage to aspire to and realise our goals. The gap represents sometimes what is the human journey between where we are at and where we wish or need to be, or have stated we need to be, such as with the NDIS vision. Sometimes it's where we thought we actually were, and sometimes we find ourselves going in circles and we end up right back where we started. The journey in between can be hard if we don't know where we are or where we're going. Reality, though, often keenly avoided, is what it is, no matter what any one person perceives it to be. If it's on fire, it's on fire. Much like gravity is always gravity. Despite our ability to overcome it, it still remains. Sometimes, thus, we still crash and burn. It frustrates me when political figures make grandiose statements like, "We are the best country in the world." We may wish to be, but we haven't defined or agreed upon what the best country would look like, which is our destination, or indeed what we need to do to get there, which is the gap. Or even worked out where we are now. They either are implying great patriotism or the will to placate us and have us believe there's nothing to see here, it's all fabulous. Either way, it infuriates me. Many aren't having the greatest time, and that kind of talk comes across as an unwillingness to listen to our reality. That, quite frankly, frightens me and causes me to lose faith. We all make goals like to be thinner, fitter, grow a company, build a house, or change and shape society. And we then need a guide and a map, a way of getting there. To have the goal is an accomplishment in itself. Absolutely, but we need to do the work to get there. Nothing happens by sheer will. We can't manifest a better world by dreaming about it, no matter how poetic the words. Simply stating it does not make it so. We also need to identify where we are at now to make a goal. To be thinner, you got to admit you need to lose a few pounds. As they say, the Nile is a river in Egypt. Consultants make a huge amount of money finding that gap and making maps to our desired destinations. We call these people our philosophers and our thought leaders, when in truth, a great deal of the time they simply state the bleeding obvious, or perhaps what should be obvious. It's why we do audits and royal commissions to check for gaps. Maybe it's better for deniability for some politicians if someone else says the obvious. I wouldn't have thought ignorance was ever charming or plausible. So in short, it is a huge deal that we are in this position to even be able to make suggestions to a government to find and bridge the gap, to accept that for far too many, their reality needs to change. We should be grateful for that opportunity. Hats off and all that. When considering bigger picture stuff, humanity in itself can be a bit of a wistful concept. In our hearts, it's about spirit, overcoming the human condition. In practice, it's about government policy, institutions, be they schools, armies, social care, disability or aged care, or even the parliamentary system is actually an institution. It's also about survival, about Netflix, careers, families, holidays, plans, and even our tragedies. Surviving in this world and surviving the civilization that we created and actually control. Despite individual action, the society we live in is a reflection of the government of the land and the people who live there. Are they benevolent? What is their social policy? Do they possess the imagination to realise the right destination? Do we, as the government's ultimate consultants, have the vision? Ironically, was the environment nurturing enough? Are we educated, fed, housed and employed? Are we able to guide and inspire our governments in a right direction? And what is the right direction? Where the hell are we going? Should we be going there, or do we need to change direction? Many of us believe that the future holds the possibility of a world where everyone is included, where there is no suffering, a benevolent society. Few of us would subscribe to any system if we truly believed the present was the end game. Yet we do, in the belief that we are headed somewhere, this unidentified, unquantified progress thing, where in fact progress is measured in capital gains, in GDP, not in terms of our humanity or progressing it. In fact, those two concepts seem to be in direct opposition of each other. Governments of the day react and respond to what gets them votes or into the history books, and ultimately re-elected without being hung in the main square, preferably, or in our own country, sent to the knackers. The gap between the utopian ideal, our vision of a better society, much like the NDIS, is often the reality we live in, or our lack of perception of the present. It's a matter of getting the right data or information out. Is it what the media paints or the government feeds? And how close to reality is that to the reality the rest of us schmucks live day to day? Deinstitutionalization has been branded around like a virtue signaler's ultimate trophy, with little playtime afforded to the reality of the privatisation of the disability healthcare and social care industry. Sometimes ambitious people can pat themselves on the back just a little prematurely. I don't think we truly understand what deinstitutionalisation actually is, let alone that we are any closer to achieving it any more than we have solved the conundrum between free will and financial servitude. The gaps that exist in the NDIS dream are large in number, and chasms that challenge the Grand Canyon for size. The reality is we had no idea how big a gap there was between what we thought the disability world was and where it really was when the NDIS began. Then there was the gap in knowledge and skills, staff, accessible accommodation and equipment, the gap in beliefs, vision, costs, and the little thing called reality. The gap filler Royal Commission's report comes out soon, and I suspect it will say there is a gap between the law and conduct, human rights and reality. Did anyone consider where will disabled people live in the community? For that matter, I don't think it was considered where any of us would be living. Slight oversight there, folks. There aren't enough homes, and so few are accessible. Where will disabled people get their hair done, go to a dentist, work, go to school, in this far from inclusive society that we have? A vision cultivated in a vacuum in a society that it would seem is totally unaware of the vision. I feel we frequently now blame society and people for ableism and slights upon this new inclusive existence that so few actually know about. Most people don't know someone in a wheelchair and generally want to help, don't know how, and are castigated and demonised for their lack of knowledge. We can't cancel everyone who uses the wrong term or doesn't know or understand a person's disability. We got to be inclusive in our quest for inclusion. Education is just an unavoidable burden, I'm afraid. How is choice and control implemented in a society where few people actually have choice and control? Reality doesn't seem to matter for such visions. Preparation of how to run a small to medium enterprise, employ staff, operate in society, interact in an able-bodied world and be prepared and skilled to do so isn't a priority or necessary. Apparently, unrealistic expectations will not mould society, but cooperation makes so much more possible. Where was the guidance and the knowledge imparted beyond just having the expectation of this inclusion? Having said that, there is absolutely no excuse for government-funded agencies to not be disability-friendly or inclusive. Every government department, state or federal, should have disability inclusion. The lack of enforcement of legislation totally negates the very existence of it. I think it's outrageous. We lack the expertise in OTs, physios, as well as support staff. It's like someone watched that baseball movie and believed if we say it will happen, it will. Healthcare inaccessibility causes greater health issues and inflates costs of NDIS care needs greatly. There is a direct cost correlation between poor healthcare access and cost of plans. Employers have no idea how to employ people with a disability. It's cool to offer 10 grand a head, but how to integrate and educate and accommodate needs to happen with information and communication, not just goodwill. The legislation for integration doesn't exist. We need a Bill of Rights federally, and we need a Disability Act that is enforced. It's bloody useless when the government doesn't even follow it. The Guardianship Acts could also align themselves with the UN Articles of Human Rights for a good start. In fact, the implementation of supported decision-making and abolishment of current guardianship is my preference to guardianship. However, the numbers are increasing in guardianship numbers, which the NDIA want nothing to do with, and leave providers to their own devices. With the horror guardianship stories, it seems we are so desensitised by trauma that we aren't even alarmed by that anymore. The real irony, however, with deinstitutionalization manifests itself in the attitudes of people, be they disabled or in the community. Change needs a guide, or capitalism will design the outcome. Costs will dictate the outcomes, not any vision. It's all we can afford, or that we are the victim of the lowest bidder has long been our downfall. Deinstitutionalization has just left many with disability feeling like a square peg, and society is the round hole. To many, simply closing the buildings changed it all. So we build group homes and apply care in the community in exactly the same way we did in the institutions. Just a different building and expect a different result. We are still institutionalising people. It's a culture, not a building. Our lack of planning, our future world generally has often landed us with an inconvenient, quite unintentional truth in our present, and an unpleasant reality, one that is often contrived and spun by our leaders at the current government or at the previous as justification of their own existence and represents their own inadequacies. It's really hard when examining the realities of our own lives to see how we fit in when viewing the country's carefully contrived statistics. The picture painted is often nothing like what a great many of us are actually experiencing day to day. Despite the constant gaslighting that we live in the best country in the world and the pain of the cognitive dissonance the current reality gives us, when many of us are left to sleep in tents, or can't get surgery, or wait for hours in ambulances, or work insecure, dead-end jobs, unable to ever afford the house our parents purchased for a fraction of the cost on a much smaller income ratio. Too often, the bread and circuses activities captivate the nation, and a winning football team affirms the belief that we truly are doing okay. Watch the eager politicians wishing to connect with the people rush clad in team scarves to a big game. It is lazy populism, and I have zero respect for it. Our government policies are entwined and often accumulated over decades before they implode. So much so, it's quite difficult to define exactly where the incompetence pandemic began. Our economic policy that we don't print money but encourage immigration en masse to avoid recession has left us with woefully inadequate housing numbers. Governments over decades went from 20% of stock being social housing to less than 2%, and flogging what we had off, else they might have to maintain it. I mean, thank God for asbestos, right? I mean, it's the only thing holding a great many social houses together. We have an ageing population and deinstitutionalization, and yet accessible housing seems non-existent. If you can afford to live anywhere at all, they effectively privatised social housing. And there's no way the private sector give a crap at all about any benevolent purpose other than their own. Perhaps government should make benevolence attractive if they wish it to be their social housing policy, or perhaps they should crack on and build some. They seemed quite happy to flog them off. Why not build them with disability support pension friendly loans? The new owner has a lifelong reliable income, no SDA required, all win-win. All it requires is some imagination. In addition to an expensive Royal Commission into early child education, what about one on how to strengthen families, rather than the state stepping in to see that children meet their developmental goals? What about strengthening of families? What about mothers and fathers who choose to stay at home? Or has that been decided upon by others already? Instead of more extensive before and after school care programs for mothers to remain at the grindstone and kick it with the other girls, what about changing the workplace so it's child and family friendly? Why have studies overseas shown families are important to child development? Less school hours and less work hours. Why are we so far behind? God forbid mum's a support worker, kiddo. You'll be lucky to get a crappy ice cream cake and a Happy Meal toy for your birthday. But hey, at least from 3, you can start your 12-hour days early. How many studies show that was what was lacking more? State intervention in favour of a stronger, stable family and a family home and a stable family income. What if we looked at the aged care crisis and planned for it? And segregated funds in people's own super to invest in a lump sum payout for your own personal care, so you're prepared. What if they didn't need state care or nursing homes? What if families could look after their children at home, or their own businesses at home, or take care of granny? Well, houses will have to be accessible first of all to accommodate for ageing in place. We need innovative policy and imagination, and never more so than now. The same doesn't work, hasn't worked, so piling more funds in the same won't fix many of the institutions we rely on, such as the hospital system, the prison system, education and aged care. Privatisation of disability care has meant public hospitals are bedlocked because they are the carer of last resort. The reality is that the workforce to care for these people doesn't exist. The irony is the people being shoved in those beds are the kind of people the NDIS was meant to look after. Those immigration numbers brought in large numbers of people which have flooded aged care and disability care, hospitality and of course Uber, but at a huge cost. We didn't train our workforce, and the many royal commissions hence have yet to look at government policy as the cause, especially our economic policy. The workforce and the workforce failures seem to have escaped the imaginations of most. Support workers are expected to work with little training and a huge range of tasks with no career progression. Support with high incidence of risk and abuse and injury. Even transporting the unskilled from overseas, we won't get away with winding the workforce progressions back 100 years and expect people to be flocking to it. They need training, career progression, job security, support, and workplace rights. We have modern slavery in this country, for goodness sake. Exploitation is not an answer to our care crisis. In addition, healthcare just isn't accessible. Disabled do not have access to dentistry, obstetrics, medical imaging, and many, many more areas. Poor healthcare means poorer health and higher costs in care. Do we speak of this when discussing NDIS costs? The impact on poor access to health on plans? Do we? Damn well we should be. Trying to get in front of a health minister about anything disability, and the answer is, that's a federal matter. Unless, of course, you're asking the disability minister, then it's an NDIS one, which everything disability is an NDIS matter. We could make a start and allow GPs to charge for their reports. We often expect from them, because doing it for free is not really working. The big idea was that the NDIS would magically encourage a great equalisation like an osmosis or magical Wi-Fi cathartic event that would suddenly infiltrate the workforce with people with disabilities. The society they are entering has no idea about disability, and most employers would not be keen to also be pseudo-providers. I mean, the government isn't even employing people. Yet workhouses for disabled, sheltered workshops, still exist. Why? Would it not be better to educate, to infiltrate, so people with disabilities could integrate outside of institutionalised care? We shut them out of education and deny inclusive education, and then expect people to be job ready and socially educated with all the tacit understanding to survive in a society that has absolutely no idea. Did we really think that closing the institutions would end institutionalisation? How? When healthcare is inaccessible, employment is inaccessible, and people will still treat disabled in an institutional-like way, like children. What about people with disabilities? Are they deinstitutionalised? Do they understand that dignity of risk also means ownership of consequences? Are we prepared to allow them to suffer those consequences? In how many cases are the consequences theirs or someone else's? How does that affect dignity of risk? Who has the dignity if someone else's choices potentially affect another party? Society was not and still not prepared for this. This great deinstitutionalisation, which was just a great privatisation with a benevolent cloak. It was just handballing the costs away from the states and avoiding the reality of the diabolical state of disability and the free-for-all it was, and still is today. Now, to truly integrate, the true integrator is education. Until we have integration and all-ability schools, attitudes won't change there. Not ours, not theirs, and not the government's, clearly. The participant pathways look like an eclectic, disjointed tree diagram with competing dueling branches. It looks like a pigeon dipped in ink, tap-danced across a page. Corrupt and selfish agendas of individuals, agendas have outbid sensibility. There is actually no pathway. Roles are undefined, and the goals and responsibilities and accountability of those roles are undefined. We need to take a really good look at how we are trying to achieve this and ask ourselves, are we bold enough to actually fix it? Because if we don't, disability care, like aged care, will be bulk care again. And the next reinstitutionalisation will not only apply to those in aged care, as it does now, and/or with a disability, but to anyone who can't afford to live, can't manage, or requires support. Hence, we must solve the affordability of social care dilemma. It is essential that there is a greater defining of roles in this industry, nowhere more so than in support work. You seriously don't have a clue what we do. As much as let's put nurses back in nursing homes sounded catchy, it presented a truth that truly the government have absolutely no understanding of reality. The almost hilarious irony is the same routines and the same procedures are employed in community as were used in the institutions. So what changed? Well, quality of staff, supervision and accountability, and the isolation in community. A community that was in no way ready for disability. Accessibility beyond, well, maybe a ramp. Our own healthcare system, run by our own government, is not disability friendly. For goodness sake, people due to their disabilities are denied access to healthcare. I was told by a health minister's advisor they didn't know this, to which I reply, there's utter bollocks. Just like, a business continuity plan is not a business continuity plan if it has not been tested. You can't just give everyone a torch who goes to hospital and call that a solution. Risk management is about functionality, not just risk mitigation. Our mostly fully imported workforce has no career progression to look forward to. Training that is barely fit for purpose, no job security, no supervision and no backup. They are sent into homes they know little about, person, where oftentimes mental health nurses from our own health services will not attend unless with a second nurse and police in attendance. Information isn't passed on, nor is it when it serves the benefit and health of the participant. It has become an occupation with low regard, and too often the low has been attracted to it, and the better ones of us get burnt out trying to keep up. Systemic changes in preference to what suits individuals are unfortunately the only way forward. We need to protect staff and ensure they have a career pathway, that they are safe and well trained. Is it any wonder there is a safeguarding issue when the frontline role is not even understood? Insurers won't pay out if they knew it is in no one's best interests. Just as anyone aspires to do more and be more, happy shit kicker is not a thing, guys. Over 26% or so gain serious injuries at work as care plans do not reflect or respect occupational health and safety standards. Even by the NDIS plans, do not compensate correctly to keep staff safe. Roles are highly casual, there's no support, no supervision, no one to report to, and no peer support to speak of. The roles are incredibly broad, undefined, and most are totally unprepared, as they are expected to do everything to fill the gaps in reality between their participants' goals and needs and their ability. They often become like personal assistants, financial managers, counsellors, nurses' aides, case managers, social workers, and do a heck of a lot of advocacy. There is no recognition of this, and absolutely no support erroneous roles are created around the support system with people little more qualified oftentimes, with far less knowledge of the participant and no way to actually walk alongside and assist in a supported decision-making framework. Hence, choice and control, reasonable and necessary, and dignity of risk have often become weapons against support staff to employ unrealistic demands. Those gaps in care and managing another's life, which no one knows whose role it is to manage anyway. We need supportive decision-making frameworks, and we need a care pathway that corresponds with real life. Providers and support staff are trying to fill gaps. They cannot speak of them. There are staff who are not equipped to understand what it means any more than the participant does. Society has a reality to it that we watch our children traverse when they enter adulthood. They learn what is possible, their mortality, the limits of their choices, and they pay the price for bad choices. We've institutionalised people. We have wrapped too many of our disabled in cotton wool and not educated them accordingly, and basically forced them to remain childlike in their knowledge of the world. We did this, and we must nurture, empower, and guide in a supported decision-making framework so those who are affected can grow and develop, not continue our own low expectations born from an ableist misunderstanding we were protecting them. We weren't. We were setting them up for failure. They are adults, capable of full lives. Living in the community is not possible if we don't support that. Of course, this is not the case for all, so please don't castigate me. But for the majority of complex cases, this is the inconvenient truth we need to address and not dance around with behavioural management, when in some cases behavioural management is about a lack of will to develop that person meaningfully. One person's experience is not everyone's, and this is a significant issue. Plans don't account for managing a person's entire life. Not even guardians do that. We make assertions about capacity determined by how they manage their life, yet if we haven't encouraged or allowed them or taken them through that passage, why, how will they? This is an important gap to fill, and one that the consequences of society will fill for them, and is doing so with the privatisation of disability. Many companies can't afford the hidden costs of this kind of support. For many, it isn't tenable. Support providers have been denigrated to disempowered labour hire, with no information to make adequate plans or supports, no support, no handover, and all risk. Many, and I mean many, are failing. More people with a disability are finding themselves homeless, in transitional facilities and or in hospitals or nursing homes, bounced from provider to provider. The untouchables, the ones no one will touch with a barge pole because it's too complicated. There's often poor information about them. There's never any handover to mitigate risk or be set up to get it right. The costs of their care spiral to the millions. Not because they need that level of care necessarily, but because it has not been managed correctly. Not in all cases, of course, but in enough, and it's a concern. Then deemed too expensive, those people end up in group homes or nursing homes with a veneer of choice and control, and surrounded in cotton wool, stuffed away, not spoken of. No privacy, no autonomy, many forced under guardianship unnecessarily, and living with people they didn't even choose, living the life that was chosen for them. It's very wrong. It's poor management, lack of communication and sharing of critical information, lack of skills, and a massive gap in capability in the care pathway process. I want to see greater communication, and I want this stopped. For many, I'll bet the term, "I hope you're living your best life," isn't a positive thought at all, but a curse. A bit like that Chinese one that says, "May you live in interesting times." To find gainful employment, more than a token few dollars an hour requires support, and we haven't allocated who shall walk that pathway with people. Yet another gap. One unidentified that has contributed significantly to a safeguarding oversight that has cost potentially billions in dollars and much suffering. Let me ask you, how much choice and control do you have, friend, when your care is inconsistent? For how many of you is capacity building your support worker sat on the phone for 3 hours? When you're stuck in bed and you can't go to that event or apply for study or even go out for a meal, how many friends can you make from your bed? Choice and control is utter rubbish if you do not have your care sorted to the point it can be taken for granted. Then you are master of your destiny. Your own destiny, not the one another chooses for you, and being told how wonderful it is. Everyone has the right to imagine and aspire to a life beyond their daily survival needs. If we can't get past that, we can't realise the NDIS vision at all. Of course, the implementation and projected costs of the NDIS was the greatest gap of all. While states citing potential bankruptcy saw it as an opportunity to offload mental health, avoid support in education, avoid accessible healthcare, address inclusive employment, this does not seem to align itself with the initial forecasts of the NDIS, nor did we fully understand nationally just what the cost benchmark actually was, because it was in such a woeful mess. In addition to that, no compensation and calculations appeared to have been made to account for that gap. The gap in where disabled sat in their lives with care and where there's needed to be. Not fancy yachts and second stories, I mean provision of support, wheelchairs and therapy. We were really behind. Yet many of those legacy providers still reign supreme, interestingly enough. So for many, the NDIS has totally changed the lives of so many. However, I have concern that those who perhaps would have been envisioned as the targeted participant with physical disabilities, they've been left out. We lack the skills to provide the support, and these people end up languishing in institutional care, nursing homes or our hospitals or places like Regency Green. Hey, how many live in institutional care chosen not to be a part of that vision? Was it their choice? Where is the media on this? Aren't there still hundreds institutionalised? Do they not count? Because they are complicated or complex, as it's often put, as if in some kind of code for too difficult. Beyond the same shock and awe stories, where's the actual journalism here? This is urgent and needs to be addressed with some expedience. What of those sent from court with no mental health facility to the community with 2 support workers, if they're lucky, to care for them? Do you think the public would be happy about this? What of the providers and support staff? Are they informed of their client's history? Where's handover? Necessity has always been the mother of invention, and no more so when it's following a disaster. Let's avoid that one, hey? Let's avoid the kind that would make our desensitised world pay attention, as the countless horrific stories that we have already heard have not been enough to date. Mental health clinics aren't sufficient to provide care for some people, but wasn't it great developing Glenside? There were even some socially affordable homes thrown in, whilst those with serious needs are literally left in the cold or in care of support staff who are all but oblivious to their needs. If we are mindful of the gaps, we can find pathways that will get us to our intended destination and realise the vision of the NDIS, so that everyone does have true choice and control, in as much as any one of us does in our own lives. So no one is bound to their care or an antiquated care system or overwhelmed by the day-to-day burden of managing it and are able to live beyond it, to truly live their way, not their best life contrived for them in an inaccessible world, but their own life in an inclusive one. To accomplish that, we must fill all of these gaps. To build the reality that we desire, the single greatest obstacle or gap that faces us is how to provide the best outcomes affordably, or for that matter, for any price. Many people have had huge plans and still remain stuck in bed with no quality of life. I can't count the number of places where there is near $1 million going into that home, and the home's a shit pit. Apparently cleaning was extra, as is too often basic care. What do you expect when there is no supervision and no fit-for-purpose training? Throwing money at it isn't the answer. If we did, we simply couldn't afford to provide the social care everyone deserves and desires. Consideration must also be given to those who provide the services. Is it too convoluted? Is there a clear pathway? And are roles understood and defined? Can we do it without exploitation and modern slavery preferably? How do we get to where we need to be with our workforce? How do we make it profitable for business and tenable for government? There are plenty of providers backing out of business, stating it is not tenable for many reasons. Gaps in plans between what they got and what they actually needed is bankrupting enough. Being paid for half an hour and having to pay staff for 2 sure as shit isn't helping. The sheer confusion of the whole thing. I cannot believe it hasn't tweaked the interest of the competition ombudsman the way this has been set up. Surely bastardising an industry the way it has been would have been of interest. The lack of standards and expense of registration has enabled just anyone, and I quote the term, get an ABN. Suddenly you lose a team because they get an ABN. No safeguards, no training, no idea how to run a business. Not in every case, of course, and I fully support boutique sole traders. But that's not what's happened, is it? No, we are a target globally. It's easier than human trafficking and the drug trade, isn't it? I mean, why do you think those same gangs have been attracted to it? How do we gain quality staff consistently and create a clear NDIS pathway for every participant? How do we streamline the pathway so it's the shortest distance between 2 points? How do we create a sector that is profitable and safe and not a bedrock for the cowboys? Why can't everyone just be registered? Registration just needs to evolve. It could involve a course for compliance and an assessment, information on how to run an NDIS business, how to use PACE, what paperwork a provider needs and actually set them up for success. Assistance, so everyone has the qualifications they need. Inclusion, novel concept. Upskill and include. Audits can still occur, perhaps less frequently. Course updates, so everyone is up to date with what they need to know and they know what's required. Help companies to achieve the standards they need, to give time to support workers and funding to enable them to meet the standards, to perform the role they are actually performing. Of course, you need to get a whole group of people together in one room who knew enough about the NDIS to produce the provider's course, of course. That might prove a challenge. It is the most convoluted, unnecessarily complicated behemoth of bureaucracy that I've ever encountered, and it serves entirely no purpose to safeguard or provide quality of care. We need as much of the dollars put to care and less on the administration and convoluted bureaucracy. I'd like to know that percentage. We are there to receive service or provide it, not serve bureaucracy. It has a disproportionate cost percentage to care ratio. And that's unfair ultimately. We will end up with an outcome we can financially afford, won't we? Hopefully we realise one day that the gap in human rights aspirations in our current reality is one we can't afford not to fill. Maybe one day we will count progress by other key performance indicators other than monetary measure. Maybe one day the cost won't be the factor that decides the lives of all of us. But until we meet that halcyon, almost magical thinking day, we will get what we can afford. So it is imperative in our current system that we either manage expectations for poor outcomes or find new and different ways to reach that vision we all prefer. It is not sustainable to reach unaffordable outcomes for the government, for the participant or the providers of staff. Everybody loses. We must change the ways we are doing things to realise the NDIS vision. I mean, there is more than one way to skin a cat, as the saying goes. Change the business model to make it tenable. We all need to play a fairer game for those of us who do treat it as the proverbial magic pudding. Cut it out. We must make it possible and affordable for people with a disability to realise the lives they deserve, and not only ones we can afford to give them. We must provide secure employment and career pathways. We must have a profitable and rewarding provider space, and we must stop the toxicity, rot and mental health tsunami this has caused nearly all in the sector. Let's acknowledge that deinstitutionalization was not just about living in the community. It was about having a life as an integrated member of the community. Not about being dumped, but embraced. Not that we build communities anymore, we build suburbs, but try going to Harvey Norman for a cup of sugar. Let's facilitate the outcome with more than magical thinking and a lot less profiteering. Let's see a government that supports the sector and doesn't cut it at the knees. Support workers are bridging gaps with extra time and commitment. They bridge gaps with their bodies when occupational health and safety has been forsaken for cost. They bridge duty of care negligence with unconsented risk by attending those who are a risk to others and themselves due to inadequate systems. They pay for gaps in knowledge, in their own knowledge, with consequences to themselves and their participants who live those consequences. Their families bridge gaps with a highly casualised, insecure job. Participants bridge gaps with their bodies, safety and quality of life. They have sold all their worldly goods in many occasions to take on Goliath at the AAT, far too often. They have given their lives and those of their parents and families and anyone who will help to advocate for them. Providers bridge moral liability gaps by ensuring vulnerable receive care even when their plans don't allow for it. They pay with risk and reputation and their own health and sometimes their livelihoods. They risk to report only to be left swinging in the wind by safeguards. Many of us have lost sleep. Government staff at NDIS and NDIA pay with overwork and stress and their time. I acknowledge all of you. We should just take the time and reflect and look at this with a different perspective and say, well, look at the kindness, the willingness is out there. Let's give thanks to all of those people. The heroes without capes, as Bill Shorten calls such people. It's been bloody hard. All of us are trying and paying in our own way to bridge the gaps we face every day in this system. To me, beyond citing workforce registrations, pathways, health and housing, I also want to make what I feel are a few critical points. The first thing I feel will help is this. This is an industry that has often been toxic. It can be wonderful and supportive, but it can also be hostile. It is fragile and sometimes psychologically a minefield. There is bullying between staff, between participants and staff, between providers themselves. If we are to fill in the gaps, the adversarial nature of this industry, ironically a care industry, is toxic. That gap right there, communication, compassion and cooperation. Let's fill that one first. We have control. It is in all of our power to do that. It is within our power to choose to do so. A little cooperation here and there, a lot more compassion for each other. We need to do that because it will take all of our ideas and a non-combative and a non-immediate oppositional response to move through this. We waste so much time and so much energy, and it costs people's lives. In all corners, from participants to staff to therapists, no one is spared from the stress and toxicity. This NDIS sandpit is kicked up. We need to work together. We need to build that bridge between each other. I think the magnificent stories of sacrifice from every corner of our sector for the common good are an extraordinary inspiration, an example of how wonderful we all are. Let's remember to celebrate that. Next, systemically, the overarching theme here, amongst a great many of the gaps, is the inability of the government to manage the gaps between state and federal. I mean, imagine relocating a heap of people to Mars. Is there going to be oxygen there? No. What about housing? Oh, no. Healthcare? No. Employment? Oh, well, no. I mean, our society is a lot like Mars. It isn't very accessible, and it inflates costs for the NDIS. Everyone wants to stay in the little safe little home pod, don't they? It isolates people and it segregates. For all of the suggestions and the advice that the NDIS review has received, the one thing that will most help beyond measure is the flow and communications between departments, be they federal or state. For us, the schmucks at home, you see, it's all the government. We don't care about your departments, and it just infuriates us when we are bounced between departments and between state or federal jurisdictions. It looks and feels too much like handballing responsibility. There shouldn't need to be memorandum of understandings between Australian government departments. I mean, it feels harder than working between foreign countries sometimes. The absolute schmozzle between NDIS and state health. Wow. The uncounted lives lost due to that absolute incompetence and unwillingness to cooperate with each other is ridiculous. It's time for government service not to be an example of a good oxymoron. For us, the schmucks, it should be seamless. I don't know, develop interdepartmental disability liaisons. Beyond the many ideas you have circulating for the review is the gaps in process, gaps in communication, gaps between government bodies that have and will continue to frustrate the NDIS vision. The rest of society, that reality in housing, schooling, access to society, that is if we want this review and whatever you do choose to implement to be successful. No NDIS plan, however big, can compensate for a lack of an accessible or disability-friendly community. Beyond employment and private business outside of the NDIS, it is exactly like a desert for anyone with a disability. The lack of access, lack of contemporary understanding of the human rights model, the archaic attitudes in healthcare rank top of my list, that's for sure. People need healthcare, a place to live, and a school to go to. It is far beyond there being only the NDIS for care and so an oasis. It's everything. I don't know what the magnitude of the Disability Discrimination Act is, but clearly it's more than an afterthought. Outside of the NDIS, we literally put people with a disability in the middle of that barren desert that I call Mars, with great stories of it being a paradise, whilst few other places other than the NDIS subscribe to the contemporary views. I mean, it's like a time machine. You talk to the NDIS, it's one way. You go to your local government department for anything, and it's like, back a century. And we found that we're square pegs, and that we just didn't fit in that round hole. The rest of government, state and federal need to be on board with the same policies and sentiments and beliefs towards disability. Make it national. Make all departments across state and federal speak the same language. Fill the gap between the contemporary vision for the NDIS and sometimes the apparent non-cooperation across the rest of government, be they state or government, federal. Disability policy and inclusion should exist across every state and every department, from Centrelink to motor vehicles. Quite right. Inclusion should not just exist in the NDIS, the only oasis outside of care but in mainstream society. That's my primary suggestion to the review panel. The putting aside of agendas and collaborating for a common purpose. And that will be a feat that will be greater than when we learnt to defy gravity in order to fly. If you want to meet your caps and stop the escalating costs, then this is entirely necessary so that the NDIS is able to equalise for the disability of the person and not the whole of society. All the NDIS can even optimistically accomplish is the formalisation of successful privatisation of disability and segregation and isolation in the community. This is a whole of government matter, and I think it's entirely relevant that government has been negligent across the board in implementing hard fought for legislation. Disability doesn't just exist within the NDIS services. Disability doesn't exist within the NDIS. Services need to be accessed across multiple sectors. Like the rest of us, it's time all governments supported each other and not competing agendas for the common good. Thanks for listening, and please like, subscribe, comment. I answered everyone's comment, and see you next time.